Hi there. One of several things we look for with fallopian tubes are sterilization devices. Here we have Filshie clips, which are metallic clips that are a type of ligation. There is also a surgical type of sterilization where they take out part of the tube, or they can put a band around the tube, which is another device. Last of the sterilization devices is the Escher coils, which are coiled pieces of metal or wire within the fallopian tube lumen. There are also a couple of benign things where you have a dilated tube filled with brown turbid fluid, which is endometriosis, and there's also um, peritubal cysts or adhesions.
Testing 1 2 3. Testing 1 2 3. This is a uterus case I'm going back to because there was something within the gross mentioning a wire coil exiting one fallopian tube segment with no indication about the other fallopian tube segment. So we really need to check and see if there's bilateral Escher coils on this case. And so here are the cervix, here's the fundus, endometrium here, smooth muscle nodules here. And if you turn this half of the uterus over here, you can actually see Escher coil exiting the left fallopian tube segment here. And then over here, you can barely see the Escher coil exiting the proximal fallopian tube segment on the right side here. But more importantly, it's always good to section through the cornu on these cases to see if there are Escher coils, and also to see if there's any kind of endometrial tumor that's kind of hidden in this area. So as you can see, I'm kind of doing cross sections or transverse cross sections through bilateral proximal remnant fallopian tube segments to make sure I don't miss any of that. So on this side, you can actually see, here's the Escher coil there, and here's the Escher coil on this side as well. I'll kind of try to zoom in so we can look at that. So I'm zoomed in, kind of focused here. And once again, here's a Escher coil right here. And then we have an Escher coil right here as well. So it's real important to section through the fundus and the cornu of the uterus on every case, because it's not always indicated in the history or preoperative diagnosis. And there is some medical legality or liability on these Escher coils because they are problematic. Thank you.
And last but not least, you can get tumor. Here we have some intraluminal tumor within a fallopian tube.
Hey, this is Jason doing a grossing tutorial video on how to process fallopian tubes. So we receive fallopian tubes primarily for ligation or for sterilization. Sometimes they come with fimbria, which are these fluffy structures at each end of the fallopian tubes. Sometimes we just get a segment like through the middle of a fallopian tube from both the right and left. Here are two fimbriated fallopian tube segments, and like I said, we get them for sterilization and tubal ligation, and sometimes we will get a single one for an ectopic pregnancy. That sometimes happens as well, rarely for tumor. However, these fimbriated ends we sample entirely for histology, because there's a 1% chance of a serous carcinoma originating or starting in these. And so we want to make sure we catch that or document that if there are any neoplastic processes starting in the fimbriated ends. So anyways, 2 fimbriated fallopian tubes. When we get these, we kind of look for any adhesions or peritubal cysts, any hydatid cysts of Morgagni, any kind of excrescences, any kind of ligation devices or sterilization devices like Uter coils or field sheet clips, those type of things. So for these 2 fallopian tubes, they're pretty unremarkable for the most part. There's an area of cautery, a line of cautery where they took it off of the mesosalpinx or the mesoovarian tissue. So you have the area of cautery, of course. This one fallopian tube here has a big peritubal cyst looks about 1.5 cm, which is not popped, it's actually still intact. So what we do with these is we measure the length on these fallopian tubes, the diameter. We talk about whether we see any of those pertinent negative or positive structures like peritubal cysts, adhesions, excrescences, or other sterilization devices. We talk about if there's any peritubal cysts. Well, here's one right here, and then what we do to try to make it easier for the pathologist is we'll ink one of these fallopian tubes a color, and then don't ink the other one. So when we sample it, they'll know that there's 2 fallopian tubes present, and the sterilization process or ligation has taken place. And then put a little vinegar on there to make the ink stick. And then we're going to section these, and we're going to submit, like I said, the entire fimbriated ends longitudinally at 0.2-0.3 cm intervals, and we mentioned that in the dictation to make sure that the pathologist knows we submitted it entirely, and also in case there is a serous carcinoma in one of these tips, the surgeon will know it as well. So we're just going to section amputate or do a transverse section at the very distal end of the fallopian tube. We're going to section the fimbria at 0.2-0.3 cm intervals. We're going to submit all that, and then this has got the peritubal cyst right here. Just going to put a hole in it and get the fluid out of there, and then we're going to sample that since we talked about that, right? So this is going to go in the cassette, and then I'm going to try to get one more section to document the transverse section of the fallopian tube or tubal structure. I'm just going to section the rest of it, and then make sure there's nothing else going on that one. And you'll notice I sectioned the uninked one first before I did the one that's inked. Like otherwise I'd have to section this and throw away this blade and get a new blade for the one that's not inked, because I don't want to transfer green ink to one that is not inked. So we're going to do the same thing for this one. We're going to amputate the distal fimbriated end, and we're going to section these at 0.2-0.3 cm intervals, and then we'll do some transverse cross sections to make sure we don't miss anything. And we'll do 2 cassettes, and we'll put all the fimbria in, like I mentioned, and then do a couple cross sections. So that's going to be it for this case.